Now, I want to go ahead and talk to Lauren first because you have had a couple of procedures. You were dealing with the spider veins and what else?
Reticular.
And reticular.
Mm-hmm.
Okay. So when you went to see the wonderful doctors over at Veintec, what types of issues and symptoms were you having?
Well, I really wasn't having any symptoms per se. I just wanted to have the spider veins removed, you know, because I really hadn't been able to wear shorts or a swimsuit or anything like that for a long, long time.
So they just made you feel uncomfortable.
Right.
So we actually have an example of spider veins if people aren't exactly sure of what we're talking about. But this is not you, but this is an example of typically the types of spider veins that you treat. Correct, doctor?
That's correct, yeah.
So tell us about the spider veins. Is this something that more women deal with as opposed to men?
This is more commonly seen in women, and some of that is because of the birth cycle that they go through and hormonal exposures. And it's really just prominent veins that are very close to the skin surface, and the vein itself is transparent, but what you're seeing is the blood running inside it.
And a lot of people, like Lauren was saying, they just deal with it or try to cover it or maybe don't wear what they want when really they can be treated and it's quite simple.
That's correct, yeah.
Tell us what you did for Lauren.
Well, what we did was we obviously identify where the spider veins are, and there are certain deeper branches that perfuse those spider veins, and we inject them with a scarring solution that burns the inner lining, and then we put compression on top and causes it to seal off. So once blood no longer flows through it, you don't see the vein.
And that's it, they're gone.
Pretty much.
At least those are gone, right?
Yeah.
Those are gone. Now, Lauren, tell me about the procedure because you went in, you had this done. Were you in and out in one day, no problem?
Well, I had to go back several times because I had a lot.
Oh, okay.
I had a lot of spider veins. And so I went back several times for the procedures to be done, and you know, it was, after a while, it was very successful.
Yeah, absolutely. You're very proud of those gams now, huh?
Yes.
Okay. Was it painful? A lot of people want to know, did it hurt? Were you able just to go about your regular day?
Oh, yeah, yeah. It stings, you know, when they put the injection in, and you just have to kind of take it easy. I had to wear compression hose for a while.
But I'm sure it was well worth it.
Yes.
Because how long had you suffered? Had you just been dealing with those spider veins and just not wearing what you wanted to wear?
Oh, probably about 15 years.
Well, that is too long, Lauren.
Yes.
I hope you're showing them off now.
Yeah, I went to the beach this summer.
Well, there you go. And I hope you pranced on the beach.
Well,
come on, Lauren.
I tried.
Good for you. Good for you. Yeah. Now, you had the spider veins, but you also had another procedure for something else you were dealing with. And what was that?
Well, that was at the very beginning for the reticular veins, and he would probably have to explain that a
Tell
little
us
better.
about, the reticular veins. What do you do for that, and what are the symptoms of that?
Well, the reticular veins are actually just a little deeper than the spider veins, and you can kind of see the bluish green
I do.
veins.
Okay.
They tend to perfuse the spider veins, which are more superficial. So if you don't take the reticular veins out, chances are those spider veins will recur fairly soon.
So the reticular veins come first and then the spiders?
Well, yes. The spider veins are as a result of the reticular veins that are deeper inside.
Okay.
It's like kind of like weeding. If you don't take the roots out, the weed will just grow back again. So
Makes
that's the
perfect
idea.
sense.
Yeah.
And then finally, I want to talk a little bit about varicose veins because this is not something you dealt with, Lauren, but a lot of your patients do. Tell us about those, and this is an example here. Now, these can be extremely painful and a health risk if not treated, correct?
That's correct. The varicose veins are the more what we consider the symptomatic varicose veins. They're bigger, they are bulging like worms underneath your skin, and the symptoms actually progress during the day when you're on your feet and you're walking around going about your daily routine, so your legs feel achy, heavy, and a fair amount of discomfort at the end of the day.
And you can treat those how?
And the way we treat them is we tap into an ultrasound to identify exactly where the leaking vessels are. As you know, the veins have valves in them to help blood flow against gravity, and when those valves stop functioning by virtue of profession, family history, and multiple medical issues or history in the past, then we have to identify where those leaks are, and then we correct those leaks and therefore address those varicose veins.
And you really are the absolute best at what you do at Veintec. They have the best doctors. Lauren can attest to that. Now, if you would like to give them a call, here's what's so great. They have 2 locations. Wherever you are, you can find one near you. They're at the Medical Center. They're also over in Stone Oak. Those are the addresses. They have a website, Veintec.com. You can log on, set up an appointment, give them a call, and they even have a special offer For our viewers, if you give them a call, the first 10 callers, you get $100 off any cosmetic procedure. And the phone number there at Veintec, 614-7467.